We meet with families who have been diagnosed with a cancer in the family or a cancer in the individual themselves. We look at the family history of cancer. We look at other features that can be associated with a presentation of cancer in the family and try to determine if it looks as though there is a pattern that would be suggestive of an increased risk for family cancer based on the history and the presentation. We look at 3 generations, we look at the types of cancer, whether there are clusters, ages at diagnosis, and then we go on to determine whether or not there are screening needs that should be adjusted for additional family members. We really stress that we are very personalized and very individualized in our communication, that we don't have a one-size-fits-all. We like to assess a family for what their particular needs are, and we like to meet those needs. When you come to see me, you could be anywhere within the continuum of care, the pre-diagnosis, early intervention, early diagnosis, or we often see family members who are years after their diagnosis of cancer and they've been treated already, and their children have grown or the family has expanded and they're more concerned. So when an individual comes to see me, they can be anywhere from just concerned about cancer based on family history, or you might be asking me to have information provided to you in order to have access to support for making medical management decisions. We have several avenues for entry into the program. We receive a lot of referrals from physicians. We receive referrals from patients who are seeking more information themselves. We have community people who call and ask for information. We have family members who have been referred from other institutions because we're listed on national websites for access to care. We also screen every individual who comes through the Cancer Center to see if there is a potential for benefit from participating in the program. And we'll reach out to those individuals with an invitation to come see us. I've been a nurse for almost 40 years, and I've been part of the Hunterdon healthcare system in one capacity or another for 39 of those 40 years. A good portion of it I worked in a family practice, and my master's in nursing is actually in family health. So the focus that Hunterdon offers on family care and the Hunterdon healthcare system and its primary practice and the Hunterdon Regional Cancer Center and its support of a family risk assessment program allowed me to really take my love of family nursing and my extra training in oncology and genetics and blend them into what appears to be a very, very unique program within the nation. And Hunterdon is one of the very, very few community systems that has allowed as extensive of support, family involvement, attention to detail, outreach, and follow-up to really promote family care that I have seen of any of my colleagues around the nation. So I would say Hunterdon's devotion to caring for an entire family is what sets us really apart.